University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
What are the best ways to protect yourself against skin cancer, and what symptoms should lead you to see a doctor? My guest is Dr. Mark Russell. He's board-certified dermatologist who specializes in treating skin cancer. Welcome to the show, Dr. Russell. Tell us, what are some of the best ways to protect ourselves from skin cancer?
Well, I think there are three areas that you should focus on: prevention, early detection, and effective treatment. And along the lines of prevention, sun exposure is the most preventable risk factor for all skin cancers, including melanoma. And you can prevent your risk by seeking shade whenever appropriate. And usually the sun's rays are strongest around 10 a.m. to about 4 p.m. So if you're out in the sun at this point in the day, then you should try to seek shade whenever possible. Wear protective clothing, such as a long-sleeved shirt, pants, or broad-brimmed hat, and sunglasses whenever possible. The use of sunscreen is also very important, and we generally recommend a sun protection factor of 30 or greater, as well as a broad-spectrum sunscreen. And this should be applied evenly and about 20 minutes before going out into the sun, and reapplied about every 2 hours, even on cloudy days, and maybe more frequently when you're swimming or in the water. You should also use extra caution when you're around water, snow, or sand, because you not only get the sun coming from the sky, but you can also get reflected ultraviolet radiation coming from below. And finally, you want to avoid tanning beds, because there are ultraviolet radiation rays that come from tanning beds as well, which have been shown to increase your risk for not only sunburn, but also skin cancer.
Dr. Russell, if people were to give themselves a check and to see a dermatologist regularly to get themselves checked out for skin cancer, what would we be looking for? What are some of the signs, that would send us to a doctor? What do they look like?
Well, you want to be aware of new growths on the skin. We do have the potential to get spots on our skin that come especially with aging, and the vast majority of these are not cancerous, but new growths that come up that may bleed, or that crust, or that are painful or tender, that don't heal, or that heal and then recur in the same area, would warrant further examination by a physician. Spots that may come up that look different than other spots on your skin, those should be checked out. A spot that has a change in sensation or develops sensation, such as itchiness, tingling, burning, crawling sensation, that could be suspicious. Moles that change, that become larger, darker, or irregular at the border, would be a reason to get checked by a physician.
So what treatment options are available? If you spot something, we go to see you and you say, yes, this is something that we really need to take a second look at. What is the first thing that you do with patients?
Well, the first thing we do is we look over the entire patient to make sure we know what we're dealing with and how many potential spots are suspicious. We would move into doing a biopsy if necessary to help confirm our suspicion and to develop the most specific diagnosis of skin cancer that we can get. And then we move into a variety of potential treatment options, and those will vary depending on things such as the type of skin cancer, the location of the skin cancer, what, if any, previous treatments have been used, and the patient's age. We have, fortunately, a large number of treatment options, including topical medications, various types of surgery, photodynamic therapy, laser treatment, radiation treatment, chemotherapies, and immunotherapies if necessary. And really, the best treatment plan is developed by a physician or even a team of physicians experienced in dealing with skin cancer.
When you do a biopsy, you're checking to see if this is something more serious like melanoma. is there a chance that it's going to come back right in the same place? Do you do a Mohs where you're really getting those markers very well? How does a patient kind of assess that this is what you're doing?
Well, we start with a biopsy to figure out exactly what the diagnosis is, and then we may go further to do a surgical excision or procedure that will definitively remove the remainder of the cancer. And it really depends on what type of cancer as to what type of treatment is best. And the patient has to confer with the physician to understand exactly what it is the physician's treating and what the endpoint is in terms of removing the cancer. Generally, we try to remove all the cancer, get the margins clear, make sure that there's no cancer remaining, and then plug the patient into a surveillance routine where they're coming back, checking with the physician periodically just to monitor for not only recurrence of the spot that was treated, but also potentially new spots that come up, because when a patient has a skin cancer, they are at risk for future skin cancers.
So, Dr. Russell, you mentioned, skin protection. And there are so many sunscreens on the market, it's so confusing. What do you want us to know when we're looking for these? To protect ourselves from skin cancer, should we be reading the labels?
Absolutely. There are some components of a sunscreen that have been designated as being more effective. I like to think of designation of BW30 when I'm deciding on sunscreens. The B stands for broad spectrum. That means it protects not only against the ultraviolet B rays, but also the ultraviolet A rays. You'd like to get a sun protection factor, an SPF of 30 or above. And you also want it to be a water-resistant sunscreen, which is a designation that implies that it stays on longer in water when you're either swimming or participating in water sports or even out in the hot weather and sweating. An SPF of less than 15 would not be considered effective at preventing skin cancer or photoaging, merely reducing your chance of sunburn. So you'd like to look for those three factors: broad spectrum, water resistant, and an SPF of 30 or above.
Do you care if it's a spray or a cream?
As long as it's applied uniformly and evenly, both sprays and creams have been found to be effective.
Well, because, for parents especially, when they're trying to keep their kids from getting sunburn, those sprays are really one of the better inventions and make it much easier to get the kids, as long as you say, we get really good coverage and we make sure to put it on pretty thick.
Exactly. You just want to make sure that with those sprays you're not doing it in a windy area, because that can make it less effective. But once the spray or the cream or the lotion or whatever the type of sunscreen is put on, as long as it's put on evenly, it should distribute and be protective. And it should be put on about 15 minutes before you actually go out into the sun to allow it to stabilize and settle.
Dr. Russell, why should patients come to the UVA Cancer Center? And please give us your best advice for preventing skin cancer.
Well, I think the physicians at the University of Virginia Health System are well prepared to deal with everything from the relatively simple and uncomplicated cases of skin cancer to the most complex. And when the need arises, the team at the University of Virginia can come together to gather their collective wisdom of as many experts as are needed to develop a comprehensive plan for the patient. And there's an outstanding team of physicians in the UVA Health System with excellent training and substantial experience dealing with skin cancer. And I think it's this training and experience that leads to the best outcomes for our patients. So in terms of best advice, protect yourself, be prudent when out in the sun, try to minimize your ultraviolet exposure both from the sun and from tanning beds, monitor your skin monthly, any changing or suspicious spots on the skin, get those checked out early with a physician, because the best chance of effective outcomes or good outcomes are to detect skin cancer early and treat it effectively.
Thank you so much, Dr. Mark Russell, board-certified dermatologist specializing in treating skin cancer. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.